Hi guys, and welcome back to another video. So as you can see, I am at work. I'm not at home because today's video is a little different, and I think it's really fun. I'll be showing you the behind the scenes of what happens for your dental appointment. So what exactly happens when you come in for your appointment and all the work that we dental practitioners put into preparing for you. So without any further delay, let's get started. Before we get started, actually go ahead and give this video a thumbs up and subscribe. We're smiling all the way to 2,000 subscribers. So yeah, now without any further delay, let's get started. Alright, so the very first thing I do is to prepare the room, and I make sure the room is clean, and I also make sure my tray is set and everything I need is on it. Once my patient arrives, I put on some of my PPE, my personal protective equipment, so my coat, my mask, and sometimes my bouffant cap, and I go to the reception to get my patient. So once we get to the room, if it was a new patient, we take a photo of them for their patient profile on our dental software, and we also would go through the patient's medical history. If it's a returning patient, however, then we would just update the medical history, so we'd ask if anything has changed with their medical history. After that is complete, I seat the patient in the chair and offer them a massage from our dental chair. And at this point, I wash my hands and it's time to begin the fun part. So I just put the patient bib on, and I also give the patient eyewear to protect their eyes throughout the appointment. So before I start the examination, I like to ask patients about their dental history and just find out if they have any dental concerns or questions they would like to ask before we get started. Next, I usually ask patients if they want to listen to music or watch something on the TV which is above them. So normally at your routine 6-month visit to the dentist, an examination is done to examine your oral health, to check the health of your gums, teeth, and surrounding structures. We also screen for oral cancer, so checking to see if there are any lumps or bumps that should not be there. So both myself and the dentist will do an examination. When the exam is finished, we discuss with patients what we found or observed and if anything needs to be done. So if we found any cavities, if we found gum disease, whatever it may be. After this, we move on to dental x-rays, and we advise that you do dental x-rays at least once per year.
Dental x-rays just help us to visualize problems of your teeth and surrounding tissue that cannot be seen by the naked eye. So x-rays allow us to treat dental problems early, which can save your money, save you from unnecessary discomfort, and maybe even your life. For example, we can detect cavities that cannot be seen by the naked eye, or even reveal bone loss, which is caused by gum disease. There are different types of x-rays. The type that you need may depend on your oral health. And this is a panoramic x-ray known as a panorex, and this x-ray just takes a full view of your entire mouth and surrounding structures. After x-rays, we can begin the cleaning. I start off using this instrument, which is called an ultrasonic scaler. And the ultrasonic scaler supplies high frequency vibrations to remove calculus and plaque. Before we get started with the cleaning, I usually tell patients, hey, if you feel any sensitivity or discomfort throughout the cleaning, just let me know and I'll stop. So after using the ultrasonic scaler, I use a hand scaler. Some practitioners use either an ultrasonic scaler or a hand scaler, and some, like myself, use both. So after hand scaling, I go back in once more with the ultrasonic scaler just to make sure all the plaque and all the calculus was removed. So after the cleaning is complete, I go ahead and polish your teeth. Polishing helps to smooth out the tooth surfaces and to remove staining. The polishing paste comes in different fun flavors and has abrasive qualities, which helps to smooth and remove staining. Many of you should be familiar with the grainy feeling in your mouth after this. After this, I just go in with some air and water just to try to get all the polishing paste off your teeth. After that is complete, we floss, which helps to remove any bacteria in between your teeth and also any polishing paste that may have been lodged in your teeth during polishing. So once that is finished, I sit my patient up and I give them mouthwash so they can give their mouth a good rinse out. Lastly, before my patient goes, I do something called oral health instruction. So depending on the condition of my patient's mouth, I would go and instruct them on what they need to do to maintain a healthy mouth.
Alright guys, so as you can see, I am home. I totally forgot to close out the video. My brain, you know. But yeah, that is it for today's video. After I bring my patients to the front, I just go back to my room, I clean up, prepare for the other patient, and I do it all over again. I also write the patient notes, which basically just tells you what I did for that appointment, the condition of the patient's mouth, or any other important detail that I need to note. So yeah, that is it for today's video. I really hope you guys enjoyed. Remember to give it a thumbs up and leave a comment. I'll respond to you. And remember to subscribe because I am smiling all the way to 2K. Thank you guys so much for the support, and I will see you next Saturday. Bye.